And with the youthful population migrating to other nations daily, many whom have dependents still living in Nigeria, the Lagos State government is looking to provide the means of health insurance to cater for the dependents in the state. The state government revealed this at an event in Lagos with a view to reduce response time in cases of emergency. Our correspondent Wilson Omoni reports.
Migration outside Nigeria has spiked in recent years, with many young residents who can afford the costs leave their dependents and siblings in Nigeria. Well, Lagos is aware of this trend and is proposing a solution that brings convenience for all parties when it comes to health insurance coverage.
I can imagine what it's like because I experienced it myself, constantly getting WhatsApp messages and SMSs and phone calls. So-and-so is sick. We are beginning to experience an aging population because Lagosians are living longer. And so we're having uncles, aunties, grandmas, grandpas, great-grandpas. It is important that we find a way to secure the health and to pay for the health of a city that won't stop expanding.
The innovation is in line with the global best practices and it's driven by technology. So there are features such as e-consulting, e-monitoring, all of which those that subscribe to this plan will be able to access.
The state government, while aware that insurance may be a luxury to some, highlights the positives as this will allow for prompt response in cases of emergency.
And it's going to have the peace of mind. It's going to be assured that indeed the person over here has been taken care of. The incessant call to keep sending money will stop, and then this money is when channeled appropriately to a health insurance plan, of course, will be spent efficiently.
So we added the telemedicine, which allows if mama is, cannot go to the hospital on her own, she can make a call to the doctor and still get treated. Also, we added home visits. So many of our elderly ones are not very mobile anymore. At least when they are over there, they've made their payments. They are rest assured that every week somebody comes to visit mama or papa at home and make sure that they have good health.
Other practitioners gathered here give their recommendations on the initiative, at some point that currency differentials and added incentives for visiting relatives can help attract more subscribers.
So we're going to be going out, as you mentioned, to missions, but luckily leveraging technology, sending a message, having stakeholder engagement as we've done in Houston, as we're going to do in London, we're going to do in Paris, in Germany. We're going to go around letting them know about this message.
Health insurance figures remain low across Nigeria despite being an obligation, allowing those with access to good health care abroad provide same for their family will boost the attitude change required.